All right, let's trace blood through the heart as it enters the heart. We'll trace it and we'll cover all the structures. So here's the right atrium, this light blue. Coming in from the bottom, we have the inferior vena cava. On the top is the superior vena cava. That's how the blood gets to the right atrium. But if you look at the superior vena cava, what empties into that is are the brachiocephalic veins, and this would be the right one, that would be the left one. Okay, so now we're in the right atrium. There's a structure inside the right atrium. It's called the Fossa Ovalle. That's us. But in the fetus, it was the foramen ovale. It was a shunt between the two atria. Okay? Then blood comes down from the right atrium into the right ventricle by way of this valve here. We'll call that the tricuspid valve, or the right atrioventricular valve. Now we're in the right ventricle. In the right ventricle, when it contracts, it goes up through the pulmonic valve or pulmonary semilunar valve into this pulmonary trunk. Now, if you think of away from the heart, away, they're all arteries, right? Away are arteries. So this is an artery, even though it's blue, because at this point it's carrying blood that's not oxygen, so they try to show you that by making it blue. Okay, so it's also called, more correct, I guess, would be the pulmonary trunk. Then it goes to the lungs, gets its oxygen. So on the torso models, you'll see red and blues, and the reds are going to be the veins, pulmonary veins, and blues are going to be pulmonary arteries. Then it gets its oxygen, comes back into the heart or into the left atrium by way of these, which are now pulmonary veins, which are red, because now they're carrying the oxygen, but they're coming towards the heart, so it's going to be veins, pulmonary veins. Now in the left atrium, blood goes into the left ventricle by way of this valve. Three names for it. We have the bicuspid mitral, or left atrioventricular. They connect, or on the cusps, CUSPS, on the cusps of the valve are these chordae tendineae structures, which attach to the heart itself by way of these papillary muscles, that little red thing there. On both AV valves, you'll see that. And then from there, the blood is pumped up through the aorta, way up inside through the aortic valve or aortic semilunar valve. Now we're in the aorta. Now it's red because it's carrying oxygen now, so we're not going to the lungs or anything, it's going to the body. So we have the aorta, and that's where the ABCs come in. A is for the aorta, B is for the brachiocephalic artery, C is for the common carotid, although in this instance it's the left common carotid, and the S, apostrophe S, is for the subclavian, but in this case left subclavian. So you have a left common carotid, left subclavian. Where's the right common carotid, right subclavian? Right here. We have the brachiocephalic artery, which is only one. It's only singular on the arterial side, paired on the venous side. Brachiocephalic artery, right subclavian, right common carotid. Okay. Then on the anterior portion of the heart itself, feeding the heart muscle, we have the anterior interventricular artery and vein, and on the back we have a coronary sinus and the coronary circumflex wrapping around the heart itself. Okay, here, really the first branch off the aorta, but we just call these because they're bigger, is the right coronary artery. And then the back side, we have the descending aorta. The smooth is the esophagus, and here's the trachea with the tracheal rings. We had a fetal counterpart, remember, in the right atrium being in the Fossa Ovalle, but we also have a ligamentum arteriosum, which is here. In the fetus, it was a shunt between the pulmonary trunk and the aorta, and it's called in the fetus, it was called a Ductus Arteriosus. That's it.